Welcome back to the program. More than 2 billion people could be at risk from Zika virus outbreaks in part of Africa and Asia, and that's according to scientists writing in the Lancet Infectious Diseases. Populations in India, Indonesia, and Nigeria are some of the most vulnerable to transmission. They use data on air traveler numbers to help model their predictions. However, they acknowledge that immunity to the virus could already exist in some areas and could reduce the risk. The research team from the London School of Hygiene and Tropical Medicine, Oxford University, and the University of Toronto, Canada, say vast numbers of people were living in environments where it would be hard to prevent, detect, and respond to the virus. They looked at factors such as the number of people who traveled from Zika-affected areas in South America. In the meantime, the WHO says Zika cases found in Guinea-Bissau in July do not stem from the strain linked to a surge in birth defects in Latin America to the so-called Asian strain. However, the WHO says an investigation was ongoing into 5 reported cases in Guinea-Bissau of microcephaly when children are born with unusually small heads, which may be linked to Zika. Earlier, we reported that researchers had warned that more than 2 billion people were in danger of Zika infection in Africa and Asia. That study said only country in Africa to have confirmed locally acquired infections with the Asian strain behind the predominant global outbreak was Cape Verde. The virus was first discovered in 1947 in Uganda's Zika forest and has now been widespread on the continent since then. I'm being joined on the program now by Dr. Marianne Ngwola. Thank you for joining us on the program.
Thank you.
Now, why is the virus spreading so fast?
But I think, as you already mentioned, the mode of transmission is very important. We know now for a fact that it's been transmitted by the mosquito, and we know how we have mosquitoes, they don't have borders. And therefore, when somebody is being bitten by a mosquito's carriers of Zika, the transmission is easy. And also, we have noticed that there are some cases of sexual transmission. So we have here a situation whereby the mosquito, contrary to the malaria, is not biting during the night. So there is no protection per se, except reducing the population of the mosquitoes to reduce the chances to have mosquito bites and then transmission of Zika. So in summary, the transmission mode by the mosquito that doesn't have borders, and of course the sexual transmission, to join makes it very easy to spread.
How would you raise a preparation for on this part of the world? It appears that there's not so much is not being said about the virus in this part of the world.
Then I think, as usual, unfortunately, we consider it as something that is not for us, it's for others, because we hear it on television. It seems to be a film happening in Latin America, but we now see that it has moved from there. It has arrived Europe, it has arrived America, and definitely somewhere in Africa. It was found in Africa first. So I think it's hard time that everybody, just as it was done for Ebola, realize that it's everybody affairs, and then we have to develop an awareness campaign that has to be translated into behavior change so that we have exactly people know what it is. In other parts of the world, it's been said that we should advise women not to get pregnant for the next 2-3 years. But now we have to ask the question here, culturally, is it accepted? How do we live with it? So the best thing to do is really to create awareness and to let people know that it is real and it's fast spreading, and we need to have our behavior change to ensure that we limit the population of the mosquitoes around us.
Well, you've talked about creating awareness, but 2 billion people are said to be at risk, and this is quite alarming. What more can we do to prevent this from becoming a reality?
I think we have to embark into behavior change. And behavior change in the sense that we know we are all responsible for our health and the environment in which we are living, because we need to have mosquito around you to bite you. So we have to reduce the population of mosquito, because if we even learn from the other part of the world, like Brazil, when it became a public danger, what did they do? They had to go for sanitation, they have to deploy the military, they have to create awareness, to go from house to house, to fleet, and also to use larvicide, as we have been saying, to reduce the population, reduce the breeding site. So we really have to organize campaigns and create awareness that will help not only for the Zika, but for so many other diseases. It's very important to do that. I think the time is now. If we don't start in a massive way, we will be very surprised because we don't have the infrastructure to face and to take care of the handicapped children that are being born. We don't have that. And it will be a burden again added to us. And we know how already our health system have been weakened, and we need to do more.
Well, have there been any efforts to develop a vaccine for the Zika virus?
Yes, efforts are ongoing, and right now the clinical trial have been done on humans. But we know around 160 people have been on the trial. But we know that from the small-scale trial to the large-scale trial, then the production of the vaccine, the affordability of the vaccine and the availability of the vaccine to reach our part of the world, it will take quite long, and we have to be able to afford it. So as we always say, prevention is better than cure. It's very important that we start doing what we can do, and it is something that each one of us can do. Let us go out, let us clean our environment, let us create the proper awareness that mosquitoes, beyond malaria, mosquitoes is Zika. Beyond Zika, mosquito is yellow fever. Beyond yellow fever, mosquito is dengue fever. And beyond dengue fever, mosquito is what they call chikungunya, a very terrible fever also. So it's very important that we realize we can do something, and it's hard time to do it.
All right. Thank you very much, Dr. Ngola, for talking to us on the program.
Thanks.
Well, elsewhere, South Africa has said it will now provide free treatment to all people infected with HIV, and that's regardless of the condition of the immune system. The country leads the world in infections. Well, before the announcement by the country's health department, people were eligible for free treatment based on a certain measure of their white blood cells, which fight infection. Record new HIV cases in Philippines prompt call for action, and the change is based on the World Health Organization's guidelines adopted in late 2015 after it was found that treating those with HIV as early as possible improves their health and prolongs their life. Let's now go to South Africa to talk to our Bureau Chief, Betty Dibia. Thank you for joining us, Betty.
Thanks so much, BC.
Now, how are South Africans reacting to this new policy?
Well, of course, a lot of people, especially the South African Medical Association, has welcomed this, not closing their eyes to the fact that it will put more pressure, but apparently arrangements have been made to take care of the concerns. But they're quite happy. Of course, the more people you have on treatment, the greater you increase life expectancy as well. But there are people who are worried about those who will feel, well, let's get reckless since there's much easier access to treatment. But despite that, we still have to catch as many people as possible, especially given the fact that, recent results have shown that younger women, especially between the ages of 16 and 24, have become even more vulnerable, are found within the new infections that we have. We have a report or a study that shows that in the southern and eastern African countries, that shows that many people, you have as much as 5,000 infections per week, and half of that from South Africa. So they see the need to go by the WHO guidelines to improve access to treatment as early as possible, because the earlier the better.
Okay, thank you very much, Betty, for joining us on the program. Our Africa Tech segment is up next. Please stay with us.